Hi there, welcome to our newest episode of And Just One More Thing. For those of you who know me, you know that I talk a lot about mental health issues, and addressing mental illness and substance use disorders has been a priority policy area for me since joining the board. Today we're going to talk specifically about 988, which is a national mental health crisis and suicide hotline number to call for support, services, connection to resources, real in the moment connections. 988 replaced a 10-digit national suicide crisis hotline phone number. But what's really special about 988 is that it has added resources, and in counties like Santa Clara, it also can connect people to direct mobile crisis services, which is pretty significant. There's still such a stigma around talking about mental illness, and part of the reason that I lean so far into this is that I know that it impacts so many of us, myself included. I have struggled to manage depression for decades, and I find that when one person says, it's me, many others say, oh, it's me too. So I am trying through conversation and through openness to really destigmatize and help people feel more comfortable accessing services for themselves. So I will share just a couple of details about 988 before we get to the experts. When you call 988 or text it or use the chat option, you'll be connected to a person who can help assess with you whether you need services in the moment or whether you're calling about a family member, a loved one, a friend, and just want some advice about how to engage with them. We have two experts who are going to talk about that a little bit more in a few minutes, so stay with us. Welcome back. I am excited to introduce my guests today, Lan Nguyen and Jasmine Kuo from our 988 call center, who are going to talk to us about how it works, why it works, and how you can be a part of this system. Hang on. Welcome back. I am with Jasmine and Lan from the 988 Crisis Suicide Line. And let me explain just super briefly why I wanted you to both come and talk with me and talk with our viewers about 988. When 988 rolled out in July of 2023, I thought the county did a fairly good job letting people know, communicating, this is a crisis hotline, this is replacing the national suicide hotline, this is an alternative to 911 when you want to call about a person in crisis rather than a crime in progress. And a year later, at my neighborhood association meetings, I'm finding out that at meeting after meeting after meeting, no one knows about it. So I realized that we clearly haven't done as good a job as I thought we had. And I want to use this opportunity to reintroduce or introduce 988 to folks who haven't heard of it, have people understand a little bit about how to use it, why it's so helpful, and hence I went to the experts. So why don't you start, Lan, with an introduction of yourself and your connection, your role within this system.
My name is Lan Nguyen, and I've been managing our local suicide crisis hotline for about 12 years now.
Oh, wow.
Even though 988 has been only effective since July of 2022, but we've been around for a long time. And with 988, there's additional resources that we could do and provide a support for the crisis caller.
Thank you. And Jasmine?
So I've been working for Santa Clara County's 988 for about 2 years now,
Okay.
half of which that time was within a volunteering capacity. And I care about the work that we do. I think it's a much needed service for our community. I think, and I thank you for the opportunity to advocate for 988 so everyone can know that they don't have to go at it alone when they're experiencing an overwhelming amount of emotional distress.
So we had a regular 10-digit suicide crisis hotline. Why did we need to change it to 988? What was the thinking behind that?
The reason was because back in 2019, there was a group of mental health and suicide prevention advocates went to DC and advocated Congress for a 3 digit, easy to remember, just like 911, where people have a law enforcement related situation, it's just call 911. Something happening and that's going on, some chaotic situation, they call 911. However, when people in crisis, they don't remember the whole 10 digit to call. So they advocate for a 3 digit, easy to remember, just like 911. So because of that, because of that, 98 became the number to call for anyone with a mental health crisis or suicide crisis situation.
So when somebody dials 988, what actually happens?
So when they dial 988, they are greeted with an automated message asking them if they would like to, if they need some services for veteran services, and also if they are needing support for LGBT related issues, because there are additional more specific call centers that are tailored to specific demographics.
Oh, okay.
And then, if not, they are then routed to the call center that is related to their area code.
So I have 2 questions then. First, how long does it take from that automated voice to getting to a human?
It's not that long. It's I would say like 20 seconds around there.
Okay. You said something at the end that just triggered and now I forgot. The call center that's appropriate for them.
But by area code.
By area code,
Yes.
Thank you. That was it. People have cell phones.
Yes.
They have their area code from New York. They have an area code from LA, but they live in San Jose. What is that helpful to them to get? Does it matter where they're getting advice from?
So I that's a great question. As far as just someone who needs support, they can talk to any 98 counselors. That doesn't have to be the local crisis line. However, if they do need local resources, for example, someone might call us at 988 and would like to be connected to a mobile crisis response team because they feel they need to have a face-to-face conversation with clinicians, for example. If they talk to someone at New York, they probably won't be able to do that.
So does the, apologies for interrupting, does the person in New York know to transfer them to San Jose?
Ideally, we hope that they would, but sometimes they're not. And because of that now, the FCC is working toward providing 988 call by geo-routing rather than by area code.
Is that already happening in our area, geo-routing by?
Not yet. Right, I believe the FCC is still working on that. But right now, I'm glad that you asked that because locally or within the state of California, there are 12 988 centers in the state and work very closely together. We know how to transfer the call back to each other locally. For example, if someone call us and they have an LA area code, they might be connected to LA, and then a counselor over there, after talking with a caller, determined, yeah, this is a caller from Santa County, they're able to transfer the call back to us. So within the California, we have that network and the centers, we're able to do that.
So it sounds like we're still working out some pieces for it to be as efficient as 911.
Yes.
One call, it's not automated. You're not sent from one office to another.
Right.
So I think that's important to know because if people don't have appropriate expectations, I would think it would be very easy to get immediately frustrated and then go back to 911. My understanding is that in many counties, the 988 number is just a crisis hotline to connect to resources. But in our county specifically, we have, I think, 4 different levels of mobile response that are possible.
Yes.
Can you talk about those different levels of response, Jasmine?
Absolutely. And if I can also piggyback on what Lan had mentioned in the previous question, most of what we do, because you said anyone can answer the calls, even if a caller or a help seeker is located outside of our county, we can still provide a service, absolutely, because most of what we do is providing compassionate support, listening support, building trust, creating a safe and non-judgmental space for anyone to express themselves freely. And that goes a really long way in helping someone de-escalate from a mental health crisis. Once they do feel, if they do need additional services, then that's when our partnership with the other crisis teams become very helpful and quite critical in some cases. One of which is a mobile crisis response team, and they can evaluate any of our help seekers if we believe that they can benefit from additional support and potential hospitalization as well to get the best care that they need. What I also appreciate from the resources that Santa Clara offers is another team called Trust, because a lot of mental health crises don't necessarily need to lead to a hospitalization. There's a lot of low to moderate level crises. And so that's why trust is very much utilized, and having that face-to-face support is a really special service that we can offer here.
So we do have a lot of community advocates who are very passionate about trust. We should say what that stands for. Trusted response.
Trusted response urgent.
ST.
Yeah, ST. Support team.
Support team. Trusted response urgent support team.
Right.
And one of the pieces that I hear that people are most interested in around trust is that it is never a law enforcement response. It is always just clinicians. Does that mean that the other response teams do include law enforcement?
Only if there's a legal, if you're only the safety concern. They go out, they meet with a caller, and if determined that there might be safety concern, then they might call law enforcement to support, but usually they don't.
I see.
Yeah.
And tell me about the people that are answering the phones and providing that compassionate voice, and also making a determination whether a response team needs to be called out. Who are they?
Sure. We have a very diverse team. Really, anybody can volunteer with 988 as long as they take our very extensive training program, of course. But we accept anyone who is willing to apply and go through the program, and then of course we go through that very extensive assessment.
Are we in need of more
Absolutely.
volunteers?
Oh my gosh,
so that's
absolutely.
A great PSA opportunity. Tell me a little bit about how long is the training, and then what is the commitment to be a 988 volunteer?
Sure. It is about total 80 hours, and it's a really dynamic experience where we incorporate not only reading, online trainings, but very interactive in-person trainings as well, so that we can have role play exercises and apply what we're actually learning to with role play exercises.
And then is it 10 hours a week, 5 hours a week?
It's about 3 hours a week.
And do you do it from your home or from a call center?
It's from our office.
Okay.
Yes. We believe that the in-person support is a really great way to build a more collaborative and supportive culture.
Well, thank you both so much, not only for shepherding this service at our county, but for helping me hopefully reach more folks. We will share the podcast and really just try to continue making sure that people know about the 988 resource, feel comfortable calling it, and then hopefully be willing to share that experience and let others know, because as with most things, word of mouth is the most compelling argument for using any new service. So with much gratitude, Jasmine and Lan, thank you so much.
Thank you so much for this opportunity, and thank you for watching and listening.
And just one more thing to share with you today, maybe a little known fact, is that I am a poet. I started writing poetry when I was about 12 years old, and I still have all of my poetry journals going back to the beginning. I won an award, I think in the late 90s, from the Judah Magnus Museum in Berkeley for a contest that they had. I won their Emerging Poet Award. I write all the time. I very rarely share it, not because I'm shy, but it's just for me always been kind of a private way to express my thoughts and my feelings. But I'm actually working on building up courage and thinking about going to an open night mic sometime soon and sharing my work. And now that I've put this on a public platform, hopefully I will feel more accountability, and you'll hear from me very soon. Have a wonderful day.